Hello, welcome to the webinar, and we are going to see the fastest path to your success. 5 crucial steps to cover in palliative cases to rock your consultations in under 10 minutes. I thank you very much for your time and all the best if you have got your exams coming up, right? Okay, so what we are going to do is, today we'll go in detail about the 5 crucial steps. But before that, have you come across any palliative cases so far? Share your questions, struggling points in the chat box. And the poll question, which topic do you want here in our next webinar? Please share your thoughts. And today we have got 2 promises. Promise number 1, I will give you the 5 crucial steps to cover in palliative cases to rock your consultations in under 10 minutes. So we are going to see the 5 crucial steps to cover in palliative cases to rock your consultations in under 10 minutes. Promise number 2, if you're ready to go deeper than this training, ready to rock your consultations fast, I promise you to invite you to our CSA Smart Success Academy. And at the end of the training, I will share the example case scenarios and resources. First of all, housekeeping rules. Have a pen, lots of paper to take notes, and have a cup of water or green tea or coffee, whichever you like, and turn off the distractions. Switch off your mobile or put it on silence mode. Close your Facebook, your email, and everything. Right, you're in the right place if you already have passed your written exams like AKT, but you lack clarity and focus on how to prepare for your final exams, CSA in UK. You feel overwhelmed by all of the different communication styles and don't have the time to try and figure it all out yourself. You're not really sure what is working now in exams and need help identifying easy steps to pass it. You want to learn from someone who has personally achieved it and guide you step by step. You have a strong will and determination to pass your exam this time. Then you will be wondering, why is this not working? What mistakes I have done? I don't know what to do. I can tell you 3 words. I can relate. As you know, I'm Dr. Hema, GP in Yorkshire in UK, mum to Adi, and a gold medalist in India, got my gold medal from President of India. And in UK, I have done MRC GP, DFSRH, DRCOG, certificate in diabetes, and I have studied in India, UK, and USA, right? But the truth is, I struggle just like you. I struggled in CSA, multiple books, courses, diplomas didn't help me. I learned by trial and error what not to do and what to do, and ended up identifying what actually works in medical consultations. And in 2012, when I was doing my GP registrar thing, I started the csasmartgroup.com. It's a free online CSA resources for doctors who feel like a lost little Nemo, like I did. Then finally launched a famous CSA Smart Success Academy. It's an online program to help doctors to rock their consultation and pass the exams with ease and confidence. It is very successful and has supported thousands of students globally. Okay, let's see our key to success. Our key to success is to become an amazing presenter during our consultation. For that, you need patients should know, like, and trust you. Don't need to worry. I will teach you how. I will share all my tips, what all I can do in this next 50 to 60 minutes. And then I promise I will show how you can take your training further. Right, you will learn 5 crucial steps to cover in palliative cases to rock your consultations in under 10 minutes. Why it's important? Why palliative care is important? It is our average workload. We will see around 20 deaths per GP per year, you know, dealing with palliative cases. It is one of the toughest scenarios in exams where many candidates fail. What is palliative care, by the way? NICE defined it as the active, holistic care of people with advanced progressive illness. We have to manage the pain and other symptoms and provide psychological, social, and spiritual support. Our goal is to give best quality of life for patients and their families. And our aim is to involve as early as possible after the diagnosis. We have to meet the needs of the patient and their family within the limits of our knowledge and competence. And we should seek specialist advice or refer the patient to specialist services when necessary. The specific assessment includes physical symptoms. We have to assess and manage physical symptoms like nausea, vomiting, or breathlessness. We have to address the psychological needs, social needs like help with personal care, housework, and shopping, and their religious or spiritual needs. The level of support people need may range from an informal sharing of ideas about life, death, and ultimate purpose of existence to the provision of formalized religious ritual. The needs of the family and carers, they may have specific concerns such as fever of the person dying and financial worries. Prognosis assessment. An attempt should be made to estimate the patient's prognosis. Some people may request not to know their prognosis. This should be respected and they should be given the opportunity to discuss it again at a later stage. We have to estimate the prognosis and it helps in the planning of appropriate treatment and care. We can use the Prognostic Indicator Guidelines. It's a part of gold standards framework. I have given the link in our resources part. It is essential to recognize the signs of dying in the terminal phase so that appropriate management pathways such as Liverpool Care Pathway can be utilized. The terminal phase may last hours to several days. The needs of the family and carers, they may have specific concerns such as fear of the person dying and financial worries should be met. Effective communication, both verbal and written, with the patient, the carers, and the other healthcare professionals is very important. Trained interpreters should be arranged if necessary. The patient should be given the opportunity to discuss topics important to them, like advanced care planning issues and estimated prognosis. Emergency contact numbers and information on what to do when death occurs should be provided to family and carers. Care of people with advanced cancer should be based on locally agreed protocols and guidelines delivered within the context of a managed system or pathway. It requires a multidisciplinary team because of the multidimensional nature of problems in palliative care. It is our duty to provide information, signposting to relevant services, accurate and holistic assessment of a patient's needs, coordination of care teams, basic levels of symptom control, psychological, social, spiritual, practical support, open and sensitive communication, bereavement support. Now let's see our 5 crucial steps to cover in palliative cases to rock your consultations in under 10 minutes. The number 1 step is how to make the best impact by your consultation style. Being a GP is about more than knowledge. It's about having excellent communication skills and being able to make a diagnosis at initial presentation. And that is what the CSA has been designed to assess. Our Former RCGP chair Professor Claire Gerada mentioned this in one of the magazines recently. As you all know, the exam fees are very high, and in CSA, we have to pay around £1,000 per sitting. And MRCGP CSA is a challenging and comprehensive examination. Good consultation results in win-win situation for you and your patient. Failure causes huge psychological and financial burden for you. My aim is to train you so that you can rock your consultations and pass your exams with flying colors. It is important that you start preparing for it as early as possible. You should know about the 3 domains on which you will be marked. Number 1 domain is data gathering, technical and assessment skills. Number 2 is clinical management skills. And the third one is interpersonal skills. During data gathering, and we should know how to use the data gathering for our clinical judgment, choice of examination, investigations, and their interpretation. And we should demonstrate proficiency in performing physical examinations and using and diagnostic therapeutic instruments. The second step in our palliative case, we have to establish our authority without appearing bossy. We have to recognize and manage the common medical conditions in primary care. We have to demonstrate a structured and flexible approach to the decision making. And we should have the ability to deal with multiple compliance and comorbidity. And we have to promote a sensitive approach to health. Let's see the third point, how to build the rapport quickly. We have to demonstrate the use of recognized communication techniques to gain understanding of the patient illness experience. We have to develop a shared approach to managing problems, practicing ethically with respect for quality and diversity issues in line with the accepted codes of professional conduct. Let's see the features in detail of a passing candidate and a failing candidate. Passing candidates, they are fluent, interactive, and very relevant to the point. They are able to take patient into medical world as a shared partner. They are open about lack of knowledge or certainty and may use this constructively. They actively monitor their course during the consultation. Let's see the fourth point, how to navigate questions efficiently. The failing candidates, they use the time very poorly. They are very uneasy with or unable to acknowledge their own ignorance or uncertainty. They look like more scripted summary than checking understanding. They are unaware of personal space. The passing candidates, they take a focused history that includes all relevant information, and they embed the questions in their previous response. Failing candidates appear to have formulaic questioning, which can become interrogative. They follow repetitive questioning, and the sequence of questioning does not make any sense. During clinical management, passing candidates appear knowledgeable and refer to recognized algorithms and mode of practice. They are able to suggest solutions to problems or a range of reasonable management options likely to be agreeable to patients. While the failing candidates, they have insufficient knowledge base or ability to think of realistic and effective alternatives. They fail to integrate and apply knowledge. They put off making clinical decisions or a clear diagnosis. Does not appear to grasp the dilemma if there is one. The passing candidates connect instantly with patient. They are non-judgmental, they are interested in the patient, they reformulate explanation using helpful metaphors. They can meet patient halfway, picks up patient's agenda, accent, or cultural approach. While the failing candidates, they are very doctor-centered and the patient's concerns are not addressed. They may look like patronizing, they are unable to explain effectively, may be wrong or not tuned to patient. They use inappropriate terms and they are over patient-centered to the detriment of clinical outcome. Now, let's see the fifth step, how to boost your success rate in exams with confidence. Given the more challenging CSA mark scheme, we recommend that trainees start practicing for the exam earlier on. Understand what the exam is testing, read through the RCGP CSA feedback statements and examiners' suggestions on how to improve on each one. Many trainees read this only if they fail the CSA and are preparing for a reset. If you can learn what makes people fail, you will know what to avoid. Set up a study group with other trainees and try to practice cases regularly, perhaps once a week from the end of your ST2 year. Try to do joint surgeries with your trainer so you can get feedback on both the communication and clinical aspects of your case. Try to do some video surgeries. You will need to enlist the help of your practice team for this to work effectively. Ask the receptionist to tell your patients, know that you're videoing as part of your training, and ask for a consent form to be signed if they're willing to take part. Make it very clear to patients that these videos never be used for anything other than your training and that they can change their mind at any time during the consultation. Watching yourself on video or going through them with your trainer often helps to pick up communication issues that could otherwise be missed. Join a course as early as possible, like RCGP course, e-Medica courses, and join our CSA Smart Success Academy. I'm going to share 10 key points in palliative care. Just sipping my green tea. Remember to consider the whole patient. Evaluate the symptoms thoroughly. Effective communication is very essential, and correct the correctable. Keep drug treatment as simple as possible. Review regularly and adjust treatment. Remember to consider non-pharmacological strategies like TENS meshing. Plan in advance. Use the preferred priorities for care document or an advance decision to refuse treatment if needed. Keep other staff informed. Ask for help. This is very vital. Refer to local guidelines, specialist palliative care team, and GMC guidelines. Right. We have seen the 5 crucial steps to cover in palliative cases and the 10 key points. Now, before the example case scenarios, let's cover my promise number 2. As promised, if you're ready to go deeper than this training, ready to rock your consultations fast and pass your exam this time, then I remember this saying, you don't have to be great to start, but you have to start to be great, by the great Zig Ziglar. So you have to start to be great. You have to take the first step towards your success. I have given you a lot of actionable information. It's like a bird's eye view on what to do on a palliative case. You should know where you are now and where you want to be. You should know about the hurdles, shortcuts, and pitfalls to pass the exam, to rock your consultation. Now, I invite you to join our CSA Smart Success Academy. In 4 weeks, you will rock your consultations with confidence and ease, even if you have failed before, or your money back. Why this is different? It's not just theory. It is a small, intimate group coaching program. You have direct access to me. You can ask specific questions about your specific challenges. A truly no risk guarantee for you. Why most trainings will fail you? The information is not enough or too much theory. No effective personal feedback is given. There is no direct access to the mentors. There's no time to ask specific personal challenges. Your trainers are too busy. You don't know your black spot. You're not aware about the unknown. You don't know what you don't know. And then keep practicing in the same wrong ways. Who is this for? You have already passed the written exams and you're preparing for your final exam and you lack clarity and focus. You feel overwhelmed by all of the different communication styles and don't have the time to try and figure it out all out yourself. You're not really sure what's working now in exams and you need help identifying easy steps to pass it. You want to learn from someone who has personally achieved it and can guide you step by step. You have a strong will and determination to pass your exams this time. Who this is not for? Non-action takers and complainers. A big no-no. CSS Smart Success Academy is an online program and you can get instant online access. You can learn from the comfort of your home. We have got 12 training topics, which includes the most important common topics. And new trainings are constantly being added to cover what is working right now. It's worth around £1,997. You will get 6 smart steps to your success, where I deep dive into the exam method evaluation, personal evaluation, patient and examiner evaluation, developing your rapid success plan, successful partnerships and relationships, and action and implementation strategies. It's worth around £197. And you will be invited to join our private Facebook group. You can ask questions, you can put your videos and ask for feedback. This is the only way you can get personal access to me. And it's worth around £197. When you enroll, you will get everything. The flagship training, 6 steps to your success in CSA, our private Facebook group, numerous case scenarios, with lots of secret bonuses like webinars, masterclasses worth around £600. Yes, you have webinars and masterclasses on women's health made easy, men's health made easy, substance misuse made easy, diabetes made easy, genetics made easy, difficult consultation made easy, and we are adding new trainings. So total price is more than £297. £2,997 with 20 years of work experience. It is priceless. You can shave off 20 years in your preparation and get all the knowledge I have acquired so far. But if you join as a gold member today, it is only £97. Amazing. Why so low? To help you to pass your exam this time. I believe you deserve it. You don't need to decide now. Try first. Join us. And we have got 30-day money-back guarantee. If you don't like it, cancel it anytime. No questions asked. Will this work for you? You can see the testimonials of my previous students. They are awesome. They are all GPs now in UK. You can go through them in detail. How to join CSA Smart Success Academy. In the next 15 minutes, this offer will go. Once you gone to the page, you can click the order button around here, become a member, and you will take to this page. And again, you don't need to have a PayPal account. You can pay using your credit or debit card. Then you'll have instant access to our online program. And a surprise gift for you, just for you, within the next 15 minutes as a webinar attendee. The first 5 to join, you will receive 1 hour Skype session. Ask me anything session with me. It's worth around £497. What results can you expect? In 4 weeks, you will rock your consultations with confidence and ease, even if you have failed before, or your money back. Click the button on the box on your right and join us now. I'm excited to see you in person. Okay, now let's dive deep into the example case scenarios. The first case, Mrs. A 69-year-old woman with cancer of the lung and known liver secondaries with increasing breathlessness, fatigue, and decreasing mobility. Concern about other metastasis and likely rapid decline. Case 2 might be Mr. B, an 84-year-old man with heart failure and increasing breathlessness who finds activity increasing difficult. He had 2 recent crisis hospital admissions and is worried about further admissions and coping alone in future. Decreasing recovery and likely erratic decline. You can come across that another case like Mrs. C, a 91-year-old lady with COPD, heart failure, osteoarthritis, and increasing signs of dementia, who lives in a care home. Following a fall, she grows less active, eats less, and becomes easily confused. She has repeated infections. She appears to be skating on thin ice. Difficult to predict, but likely slow decline. Or you may come across Mrs. DH, 65-year-old female, diagnosed with fungating left breast cancer with bony mets. She tried chemo, radiotherapy options, suffered with side effects, and she decided no further active treatment. She developed a large fungating cancer mass over 18 months. So go through these cases and I will go through main points to cover. Offer the person the opportunity to discuss topics which are important to them at that point. This is very vital in exam. Please check with your patients what they want to be addressed, what they want to cover, what is their concern, what they want, what is their expectation. Then discuss about treatment options and preferences, disease status, progression, and estimated prognosis. And look for social implications like work and income. Address issues relating to those important to them, for example, the partner and children. Cover spiritual and religious issues. Advanced care planning issues including preferences, hopes, and wishes, such as preferred place of care and issues around dying, including cardiopulmonary resuscitation and whether they have any expressed views about organ or tissue donation. Aim to address the following issues: physical symptoms and psychosocial issues, body image issues, embarrassment and depression, unable to wear clothes, avoid visits, and frequent anxiety episodes. Like, am I going to die today? Check the family support, who is the main carer, other close family members around, and community nurses' input, financial burdens like pension and house rent, etc. And check the spiritual and religious needs. I'm angry. Why I got this? Why me? Questions like this always crop up, so please prepare to address it. Check the values and beliefs in life. Check the end of life care pathway. And you should be aware about the GMC definition. People are approaching the end of life when they are likely to die within the next 12 months. This includes people whose death is imminent, expected within a few hours or days, or those with advanced, progressive, incurable conditions, general frailty, and coexisting conditions that mean they are expected to die within 12 months. That's a very long time in general practice. Existing conditions if they are at risk of dying from a sudden acute crisis in their condition. life-threatening acute conditions caused by sudden catastrophic events like road traffic accidents. We should be aware about vulnerable adult protection. If there is any situations for concern in relation to adult protection, please check with your local guidance and offer correct advice. You should know about the mental capacity assessment as well. Understand the principles behind mental capacity assessment, and you have to decide on a case-by-case basis whether the patient is competent, and always try to involve family in decision making. If in doubt, it is advisable to seek advice from your medical defense organization before proceeding. There are so many prescribing tips in my course I cover in my academy. Pain management, constipation management, cough management, management of dyspnea, malignant ulcer management, nausea, secretions, and oral care. It's too much to cover in this short webinar. Please join us, and I'm more than happy to see you. I'm excited to see you in person. These are some resources where you can go online and get the information you need. I like the palliative care guidelines and the palliativedrugs.com. They are very useful. And nice guidelines and gold standard framework, they are very vital to your practice. Okay, join CSA Smart Success Academy now, and the first 5 to join will receive a free Skype training session with me. I'm so excited to see you in person. Come on, let's rock and join us. Click the button on the box on your right now. Let's rock.